When researching centers for pediatric liver transplant, parents will want to consider a center that can treat all levels of severity of liver conditions, from the more common to the most complex. This means your child will not have to be sent somewhere else if a situation is complicated. You'll also want to consider centers that offer different types of transplantation to maximize the potential for your child to receive a transplant.
The average baby born every day, the chance of them developing one of these diseases is fairly rare, but it's something that our liver disease specialists take care of pretty regularly. When families come to be evaluated, really my primary job is to discuss all of these different transplant options and how they may relate to this particular family. Those transplant options are either deceased donation, where you get a whole organ from a deceased donor of appropriate size, or deceased donation where you take only a portion of that organ and transplant the child with a portion of that, or live donation. A living person gives a portion of their liver to that child. That live donation can be from part of the child's family, so a directed donor. We started a non-directed live donor program, and the number of non-directed transplants that we've done has been much higher than some of the programs around the country, partly because people of Colorado seem to be very generous and very giving. And so we have a lot of people who come forward who say that they want to donate a portion of their liver to somebody that they don't know, which is pretty incredible if you think about it.
Listing your child for transplant at more than one center could decrease the time that your child has to wait for an organ. Every family waiting for transplant has the right to list at more than one center.
Because of our non-directed program, we have the opportunity to offer families who don't have a live donor option to offer them that live donor option. They can still stay on their local program's waiting list. They can come out here, have a second evaluation, and then if we think they're a good candidate, they can be put on our waiting list as a double listing. Because we have that opportunity here in Colorado, we've been able to transplant at a faster rate than we were previously and at a faster rate than a lot of the programs in the region surrounding us.
We're in an enviable position where our wait list is really, really short, half of the national average. We certainly would encourage people who live outside of the Denver or Colorado area to consider being seen at our program, because we think that the chances that we'll be able to get them transplanted and back to good health sooner rather than later is high.